So let's take a look at the sinuses and how they function and how I can help you feel better with a procedure done in the office. When we take a look at this picture, the sinuses are these air-filled spaces in pink above the forehead, between the eyes, and underneath the cheekbones. And from each of those sinuses is a pathway that leads from the sinuses into the nose. And if that pathway is open, then the sinuses are ventilating and draining properly, and there's no pain, there's no abnormal drainage. But in some situations, those passageways become blocked or narrowed or congested, whether it be from allergy or just repeated infections or even the anatomy of the sinuses themselves. So what I do when you come to my office is you'll be seated in the treatment room. We'll give you some topical anesthesia in the office, which is numbing medication to make the procedure comfortable for you. And then I have a special device, which is an introducer that goes into the nose. And while I'm looking with a scope, I'm able to see exactly where I am through what's called a navigation tool. The navigation tool links the tip of the instrument to the scan, which is on a monitor right next to me while I'm working. And I can very carefully insert the wire and then the balloon into the sinus. And once I know where I'm at, I'm able to inflate the balloon, which creates a widening effect of the sinus opening, which is a permanent improvement in the opening of that sinus. We typically do this procedure in the sinuses above the forehead, the ones underneath the cheekbones, and even the ones between the eyes to facilitate better ventilation and better drainage. What does this do? This improves sinus pressure, it improves headaches, it improves the ability for people to enjoy the quality of their life because they're having less sinus infections. This procedure is covered by insurance. It has only a 2-day recovery period. My patients do not need anything other than Tylenol or Advil. It requires very little care after the procedure, and within 2 to 3 weeks, the sinuses are completely healed. We've been doing these procedures for the past 15 years, have a 96% improvement rate in patient symptoms, a 75% decrease in the amount and number of medications that people need to use for their sinuses. And most of all, it's safe, it's effective, and it's covered by insurance. I think that this could be a great option if your sinus problems are not treated adequately with medication. And I look forward to trying to help you with your sinus issues. Thank you.